Good morning, everybody. Thank you for joining us for our weekly call for reopening Ellis County. My name is Sarah Wassinger. I'm the President and CEO at the Chamber in Hays, Kansas, and we are pleased to have the Director of the Ellis County Health Department with us, Jason Kennedy, this morning. Jason, please feel free to give us an update, and at the end, we will have a few moments for questions, so there is a chat space, so please feel free to enter your questions into the chat, and we will do our best to get to as many of those as possible at the end of the call.
Good morning, Ellis County. So as everybody is probably aware, on Wednesday, I think the governor came out with another new update or change to the plan moving forward. So the modified phase 2 is what will begin as of May 22nd, tomorrow, May 22nd. So the modified phase 2 moves us out of the new phase 1.5 and does make a few changes to the original Ad Astra plan. So what this does, or what this looks like for Ellis County, is that as of tomorrow, mass gatherings go from 10 to 15. The original plan, the original phase 2 plan had a different number in there, but moving forward, we will stick with this. So mass gatherings of 15 or fewer individuals, except for those who reside together. All businesses and activities that were allowed in phase 1 and phase 1.5 are continued or allowed to continue operating, as long as they maintain the basic health practices that we've talked about. So I think this probably is as good a time as any to talk about as we move forward, as we move out of draconian restrictions, or as we move towards reopening, whatever that new normal is. A lot of basic practices will continue, the same basic practices that we've talked about. So that is washing your hands, not touching your eyes, nose, or mouth, and really that social distancing piece. So trying to maintain that 6-foot distance between you and other people. The CDC did come out with, I would like to say, they're new guidelines. The news media is treating them like new guidelines or new information. However, it's the same information that we've really known since the start. They've just reconfirmed it in that this virus does not travel well through surfaces. It doesn't transmit well through surfaces. The predominant means of transmission of respiratory virus is through droplets and particles. So those droplets travel from person to person, generally through cough, sneezes, something like that, and then they get into the recipient as far as eyes, nose, or mouth. So the predominant means of transmission for viruses is through that close personal contact, being within that 6 feet for an extended period of time. The point for the extended period of time is that you actually get enough of the viral material to become infected. So as we move forward, or as we walk forward together here, making sure that we continue that social distancing piece and that we continue to wash our hands and not touch our eyes, nose, or mouth. So any business or activities that were allowed in phase 1 and phase 1.5 can continue. We just ask that you guys maintain those basic health practices. So making sure that staff's washing their hands, making sure that you were educating staff and patrons that if you're sick, please don't come. And that's an important message really for everyone in the community. If you're sick, stay home. Avoid those large gatherings if you can't maintain that social distancing piece. The personal services, so nail salons, barbershops, hair salons, tanning salons, tattoo parlors, they had already opened in phase 1.5. They can continue to open. In the new phase 2, they still are requiring pre-scheduled appointments or online check-in. Like we talked last week, really the point of that is the contact tracing piece. So it's not something that I'm gonna come look at on a daily basis. It's not something that is a way to track or trace people, at least not here in Ellis County. The point of that is for contact tracing. What we've talked about with contact tracing is that that's the portion of this that we look at. If someone is, if there is a positive, what we do is we walk their steps back to see who they touched or who they impacted. So having that list of when they were there or when you saw them helps us with that contact tracing piece so that we can isolate and quarantine if there is any kind of exposure in Ellis County again. We're able to isolate and quarantine and try to limit the impact as much as possible. The Fitness centers. So there is a fairly significant change for fitness centers and health clubs. Currently, they are not allowed to have in-person classes. They were allowed to be open, but they were not allowed to have in-person classes. Now, come tomorrow, Friday, May 22nd, they are allowed to resume in-person classes. They have that 15 people max cap on those individual classes, and we need to look for ways to socially distance that. So as we work out now, exercise is an extremely important thing for health. It's extremely important for mental health and physical health. It helps to boost your immune system. It also has been shown to positively impact good lifestyle choices as far as eating healthy, maybe not drinking quite as much as we did during quarantine, and staying off the potato chips. So as we look at exercise, it is extremely important. However, as we exercise, we do produce more of those droplets. We do produce more aerosolized droplets into the environment. So as we exercise in groups, making sure that we distance ourselves as much as possible. I know that's sometimes limited by the space of the room, and that's something that you as individual business owners would need to look at the space of the room. Yes, you can technically have 15 people, but maybe for your space, you need to scale that back to an appropriate number that works for you. There are no building occupancy requirements, so there's nothing that says you can only operate at 50%, or you can only have. But we do need to look for those ways to socially distance while we're working out. It's also maybe a great time to look at some outdoor venues for some workouts and things like that. So it's good news that we can open up those in-person classes. It's good news that we can get back to some of those social constructs that we put on hold, but we need to make sure that we're just doing it in a safe manner. So that's the big change. Fitness centers, locker rooms still remain closed except for restroom facilities. Yeah, I got nothing for you. It's just in the plans. So mostly looking at those places for mass gatherings, I guess, but I'm not sure how many of us hang out in there for an extended period of time. So locker rooms are for restroom facilities only. Community centers are allowed to open as long as they follow the mass gathering or social distancing restrictions outlined in Executive Order 2034. Now, no, I don't think we have any community centers here that include swimming pools or things like that. But if we do, the swimming pools are still off limits, at least currently. I guess I should have started. I also probably should have started with this, but all of this, any information I give you today, is subject to change. We all know this. We've been dealing with this for the last couple of months. These plans come out. We're all learning how to be agile in our businesses and really agile in our lives. So the legislature does meet today. They could come out with completely different guidelines or recommendations. They could limit the authority of the executive orders. They could change what the level of county involvement is. So all I ask is that you guys be agile and kind of keep an eye on what is coming out of the governor's office and Topeka. As I've asked everybody from the start, I will do my part to educate you guys. I will do my part to look out for Ellis County. I need you guys to continue following the orders, whether we agree with them or not, whether we find fault or find issues in the plans. I just ask that we follow them. We can fight the orders from a place of right, meaning that we're following them, but we're still educating people, or we're still working with our legislators, we're still working with our industry leaders to come up with best practices and ways to move forward within the order. So whatever happens today, I really don't know, but we'll do our part to educate you on it. So swimming pools do stay closed during phase 2. Now phase 3 that was slated to start on June 1 actually will be pushed back to June 8th now, which is when swimming pools would be allowed to open. So at this point, swimming pools are closed unless they're used for physical therapy or first responder training. Indoor leisure spaces. So movie theaters, trampoline parks, theaters, museums, bowling alleys may open as of tomorrow, as long as they follow the mass gathering and social distancing requirements. So same thing applies to them, looking for ways to separate your spaces or looking for ways to make sure that non-cohabitating family members aren't in a close environment. Now, with these spaces, it is not a 15-person limit in the space. So let's take the movie theater for an example. The movie theater can have more than 15 people in it. They just have to have ability to socially distance people. Now, what almost every one of these orders does is it treats cohabitating family members as as basically one person, as a group. So cohabitating family members can sit together in a group. They just have to be socially distanced from another group. The other piece of that is in restaurants. You do not have to be a cohabitating family member. You actually, as long as you know the people, you can sit at the table together. As long as you all go there together, you just can't have people that don't know each other sitting together. I would assume, and because the governor's executive order does not specifically exclude that, and as we've talked in the past, Ellis County will not be more restrictive than what the governor's executive order is at this time. So those same kind of rules would apply for indoor leisure spaces as far as the theater, bowling alley, things like that. If a group comes together and it's not a group larger than 15 people, they can bowl together, they can sit together in the movie theater. They just need to be socially distanced from the next group by more than 6 feet. And like we've talked, especially with restaurants and then the movie theater, bowling alley be all the same. If it's 6 feet in between individuals, so the tables don't spread virus, people do. So making sure that we're looking at separating those individuals and making sure we understand that viruses travel in circles. They don't travel just in a linear fashion, so it's not just straightforward, straight side by side. So making sure that we're looking and making sure that we're isolated by 6 feet in all sides of them. So indoor leisure spaces are open. Casinos, which we don't have any. So organized sports facilities, games, and practice. So, and I'll read this one specifically. Non-professional organized sports facilities, games, and practices may operate as long as they follow outlined mass gathering and social distancing guidelines and follow guidelines established by the Kansas Rec and Park Association posted on covid.ks.gov. If you are one of these organizations, I encourage you to go look at the Kansas Recreation and Park Association's industry standards and guidelines. Work with the city rec, either here, Ellis, wherever. Make sure you're working with the city rec to ensure that you're following some of those best practices and that we work together in a coordinated fashion to figure that out. I'm not exactly sure what that, I'll be honest, I'm not exactly sure what that looks like, how we do all this in a safe fashion. So making sure that each one of us is doing our part to encourage those best practices, which is washing your hands, not touching your eyes, nose, or mouth, and making sure that we're socially distancing as much as possible. So how that looks on a ball field is probably different than how it looks inside a gym, and is probably different than how it looks at the movie theater. So everybody has to really look within their organization, look at the best practices, follow those industry standards, and figure out how that works for you. And then if you have questions, after you have figured out that plan or after you've looked at it and you think you have it figured out, if you need help in that, give my office a call. We can kind of walk through it with you, look at it. I've told you guys before, I'm not the best person to run your business, and I've coached enough Little League to know that I'm sure not good enough to coach anybody's team. So it's something that I would be more than happy to help as we walk forward, but I can't design all those plans for you because I don't know how it looks for you, the end user. So after you guys come up with an idea, if you have questions, feel free to give our office a call. We'll see if it meets the governor's orders and if it really just makes sense as far as a viral transmission standard. So the graduations can be held as long as no more than 15 individuals in a room. So this is the same as it was in 1.5. It just goes from 10 to 15. They've really still this order has done a really good job of basically prohibiting indoor graduations. However, outdoor drive-through graduations are allowed. The same things we talked about in 1.5, making sure that we're not having any of those mass gatherings or more than 15 people. I'm really not sure why she singled out the graduation so hard in this entire time. But if we've been meeting with the schools on a weekly basis, I've met with the schools. I'm not aware of any of them at this point planning a in-person indoor graduation. So if any of them are on this call, which and they are planning that, feel free to give me a call and we can figure out what that looks like for everybody. Let's see, what else do I need to hit on here? So as we've talked in the past, our health metrics, as far as moving forward, we still are looking good. We're 34 days since our last diagnosed case. We have to date still had 0 hospitalizations, and thankfully we've had 0 deaths. So as far as how we look in Ellis County, as far as COVID numbers, we're looking pretty good, or we're looking great. We've done a good job. Now, the virus is still out there. There are still going to be cases, maybe not in Ellis County, but there are still cases in the state of Kansas. There still are cases nationwide. We do still see increases happening. As we see that, and as we move forward, and as we continue to test more, we will continue to see, or have the possibility to see, more cases, or a case. How we move forward with COVID, how we move forward with COVID as part of the social construct, as part of our daily lives, how we handle that and move forward in a safe manner will really determine how successful we are over the next year or so. There likely will not be a vaccine, for sure not until after the first of the year. We will still see some COVID virus. So how we utilize that information, how agile we are in businesses, and how we use best practices and how we continue to adapt and change to best practices will be extremely beneficial and impactful in how we move forward. So as we look at that, Ellis County's in a good position. We want to keep it that way. The best way to do that is wash your hands, really try to limit that in-person gathering as much as possible, and just do what you can to protect yourself. Now, as we look at mortality, nobody really ever wants to talk about mortality, but in the state of Kansas, 97% of the mortality has been in the population over 55. Almost every person that has died from COVID in the state of Kansas has had a significant pre-existing comorbidity. So as you look at ways to open your organization, as you look at ways to move forward, how we protect the at-risk population. So if we look just at the mortality, which is one of the most important numbers we should focus on, as we look at that, 97% is over 55. So if you have people like that in your organization, how do we maybe take additional measures to protect them? How do we reinforce and allow them to utilize best practices to protect themselves? Looking at those numbers and how we do that, nursing homes will be something. Long-term care facilities will be a industry that will be far behind the rest of the world as we move into less restrictive measures, because that is their population. So there will be certain businesses and certain industries that really need to take a deep dive and look specifically at what they do going forward, knowing that the burden of disease is significantly higher for that population. So look within your organization, look at what the people that you serve, look at what your primary population is, and look at how this virus impacts them specifically, and what you can do to limit that is a really great thing that we can do, or you can do as business owners, to help protect them. The mass gathering, like we said, was 15 people. We'll go through a couple of these things real quick. Like I said, swimming pools are not allowed to open. They would be allowed to open in phase 3. As of today, they would be allowed to open in phase 3, which would be approximately June 8th. I will say that's one that I likely see some kind of a change for. I know a couple of the legislators were already mentioning that, just even on the news media, that there's, pools. It seems a little bit ridiculous. So I don't know. It's something to look for as they come out of session today to see if there's any changes to that. Youth sports practices, yes, they may operate as long as they follow the mass gathering and social distancing requirements. The dirt track races are allowed. They are no longer prohibited under the new phase 2. So dirt track races will resume this weekend. Community centers. Community centers are open. We all know the rules for restaurants. Bars. Bars remain closed. In bars and nightclubs, excluding ones that are operating with curbside or carryout services. Bars and nightclubs remain closed at least until phase 3, which is beginning in June 8th under the current plan. Outdoor and indoor large entertainment venues with a capacity of 2,000 or more, fairs, festivals, carnivals, and parades, they all remain closed. Like we talked about, swimming pools, and then summer camps, unless they are a licensed child care facility, also remain closed at this point. So other than that, other than those 4 things, most everything else can resume at this point, as long as we are looking at those best practices, utilizing utilizing your industry standards, and making sure that we are doing our part to protect ourselves and our patrons. That really is the bulk of the new phase 2. Like I said, everything could change today. So if you guys have some questions, we got a little bit of time for questions here, and hopefully we can get you guys some guidance.
Thank you, Jason. I just have a question that I would like to get some clarification on as we give folks time to type in their questions. If folks are traveling out of Hays, where do they go to figure out if they need to quarantine at this point for some of the hot spots that might exist in either Kansas or out of state? Right,
and that's a great question. Let me, if they go to the kdheks.gov, it will link you to a different, but it's the easiest one to remember. kdheks.gov will take you to the Kansas Department of Health and Environment's COVID page. On the main page, on the left-hand side, in the big blue banner at the top, it says travel information. If they click on that link, and we'll hit the rest. We'll hit a couple of important things on that page too. But as you click on that link, it'll take you to another page that will show you the exact states that are on those travel restriction lists. And it'll give you kind of some, it links you to their main toolkit that has a lot of other helpful information as far as traveling and stuff goes too. So that's the best source of information right now, as they are the most up to date.
Thank you. And then do you anticipate the other phases of the Ad Astra plan changing as we progress through the different steps? I'm guessing there's obviously no way to know, but since we've seen so many modifications as it is, it would probably be safe to assume that that would be the case.
I'll be honest. I have absolutely no idea. I don't know that what I just told you guys right now isn't going to be completely different by 7 o'clock tonight. I know like I said, they're all meeting. I know from the news sources that I've seen and from a couple of representatives that I've talked to, I think they are really going to push hard for giving a lot of local control back, or allowing local. So through this entire time, local authorities have not been able to be less restrictive than the governor's plan. We've only been able to be more restrictive. I think you might see some piece come in there of them allowing some local control to be less restrictive. So the governor's plan might stay in place, but local authorities could modify it up or down. I don't know currently right now, as of this minute, that is not the case. But what it looks like at 5 o'clock today or 8 o'clock tomorrow morning, I have no idea.
Thank you very much. Excuse me. It does not appear that we have any other questions at this time, Jason. Are there any other final guidelines or guidance that you'd like to give the folks out here watching today?
No, it's I think as we've talked from the start, basic health practices are really the most important thing that we can all continue to do. And really washing your hands is just extremely important. And trying to limit that large social gathering piece, trying to stay out of those large crowds. Even as we travel, things like that, looking for venues that can keep you and your family kind of isolated. So I think state parks are going to be a huge hit this summer, which is good. Getting back out into nature, getting back into exercising, continue to eat healthy, or if you didn't eat so healthy during quarantine, like a lot of us, getting back into exercising, making those healthy lifestyle choices. There are and can be some really great things that come from this, as long as we learn from what happened and we use that to guide our future. So use the history to rewrite the future. And as we do that, making those healthy lifestyle choices will be very important for us.
Well, Jason, I still don't see any other questions. So on behalf of the Chamber, I would just like to say thank you for everything that you are doing to keep Ellis County citizens and businesses up and going. I know that you went out of your way to try to write a letter for Ellis County to be able to operate a little bit differently, since we haven't had any confirmed cases in 34 days, and that is greatly appreciated. We did actually just have one question come in. How many total tests have we had in Ellis County?
As of yesterday, it was around 560-ish. The KDHE numbers are still, like we've talked in the past, they're off a little bit from our numbers. So because there was a time period where the online portals weren't working, so I would say we're around 600. And then the hospital has even done a lot of additional testing as part of their surgery procedure. So we've done, and we have met the state's metric of more than 2% in the state of May, or in the month of May. We are above that threshold of completing those tests. So yeah, we're probably right around 600 as of this morning.
One thing I know that has changed, if you want to, I guess, provide a quick update for folks, the hospital is now taking regular routine procedures and things of that nature, correct? So folks can begin to schedule procedures if they need to.
Yeah, absolutely. And just all healthcare in general. I think people have put their chronic health conditions on the back burner because they were afraid to seek out medical care because of the possibility of COVID and things like that. It is time to go back and get that in check. The best way for you to, hopefully we don't have an impact of COVID in our community, but the best way for you to fight it is with a healthy immune system, which means a healthy person. So getting back to getting routine vaccinations. The health department has been open throughout this entire thing. We continue to remain open. Through appointments, call us, we'll get you vaccinated. We have a nurse practitioner available over there, or go to your primary care physician, making sure that we are getting people back into their healthcare routines.
And then, Jason, do you just want to give one more friendly reminder of, if people want to contact you, what's the best email address for them to use to address COVID-19 questions?
Yeah, just for now, we still have the COVID-19 questions at ellisco.net. That's probably the best way. If you have a specific business question, or if you have a question specifically related to COVID, like we've talked, that's a great way for us to push you out information and make sure that we can give you those links. You can also call the health department and get us that way. But like I said, usually an email to the COVID-19 questions at ellisco.net is probably the best way. Okay.
Well, I think that concludes all of the questions for this morning. Again, thank you so much for everything that you and your department are doing to keep us safe. And also a special thank you to Nex-Tech for providing the technology for this webinar today. And we'll continue to offer these, I think, as long as people continue to find relevance and watching them. So just again, thank you for all you're doing. And we wish everybody a good day. Stay safe, make great choices for your businesses, and have an amazing rest of your week. Thanks, Jason.
See ya.